Good morning, everyone. Today we are revising the bones of the upper limb. Let's start with the bones of the shoulder girdle. The first bone here is the scapula. As we can see, the scapula is a triangular bone. It has an upper angle, a lower angle, and a lateral angle. It has a medial border and a lateral border and an upper border. It has two surfaces. This is the dorsal surface, and this is the ventral surface of the scapula. For the articulation, the scapula articulates laterally through the glenoid cavity with the head of the humerus forming the shoulder joint, which is a ball and socket synovial joint. The second articulation is here. It articulates with the lateral end of the clavicle, forming the acromioclavicular joint, which is a plain synovial joint. Let's revise the muscles attached to this bone, which is the scapula. On the dorsal aspect of the scapula, above the level of the spine, we have the supraspinatus muscle. Below the level of the spine, we have the infraspinatus muscle. The anterior border of the spine and the acromion process attached the trapezius muscle. The posterior border of the spine and the lateral border of the acromion process, we have the deltoid muscle. On the medial border of the scapula, dorsal aspect, we have the levator scapula. In the level of the spine, we have the rhomboides minor. Below the level of the spine, we have the rhomboides major. On the lateral aspect of the scapula, we have the teres minor and the teres major. In the inferior angle, we have the latissimus dorsi. Above the glenoid cavity, we have the supraglenoid tubercle. Attached to it, the long head of biceps brachii. Below the glenoid cavity, we have the infraglenoid tubercle. Attached to it, the long head of triceps. On the ventral aspect, we have the subscapular fossa. Attached to it, the subscapularis. On the medial border, we have the serratus anterior muscle. As for the coracoid process, in the front of the coracoid process, we have the pectoralis minor. At the tip of the coracoid process, we have the short head of biceps and coracobrachialis. Finally, how to identify the side of this bone? We identify the side of this bone by putting the medial border of the scapula, the medial side, this way. This is medial, this is lateral. The spine of the scapula is put at the back. This is superior and this is inferior. By putting the scapula this way, this is a left scapula. For confirmation, we can hold the scapula with the left hand, like holding a gun or a pistol, this way. This is the handle of the pistol. this way. I'm holding it with my left hand, so I'm sure it's a left scapula. The scapula is related to several vessels. As we can see, the upper border of the scapula, it has a notch. It's the suprascapular notch. It is related to a suprascapular nerve and suprascapular artery. The lateral border of the scapula is related to the subscapular blood vessel, and rounding around the lateral border is the circumflex scapular blood vessel. This is our part 1 of revising the bones of the upper limb. I hope you enjoyed. Please subscribe and like the video.